Question number 97 for pediatrics. Usually question number 97 to 120 are from the pediatric section in the UPSC pattern. Which of the following is the correct statement regarding physiology of breastfeeding? We know that prolactin is for milk secretion and oxytocin is for ejection. Prolactin responsible for ejection, wrong statement. Night feeding is important for maintaining prolactin reflex, correct. Oxytocin is responsible for secretion, wrong, it is responsible for ejection. Oxytocin is secreted by the anterior pituitary, wrong, it is secreted by posterior pituitary. So correct answer is this, option B. Which of the following fine motor milestones will appear ahead of the others? We know that circle will come by 3 years of age and cross will come by 4 years of age. But within copying and drawing, which comes first? So this is a screenshot of GHAI 9th edition. According to this, by 2 years of age draws a circular stroke. So drawing comes ahead of copying. Correct answer is option number C. Question number 99. In case of hypertensive emergency, blood pressure should be reduced by up to. So this we can predict. Just look at the word emergency. Emergency means already end organ damage is present. So we need to reduce the blood pressure quickly. So 8 hours cannot be the option. So the option number C is correct. Question number 100. What is the cutoff for fast breathing in a 2-year-old? More than 60 is for 0 to 2 months. More than 50 is for 2 months to 1 year. More than 40 is for 1 year to 5 year. So 2 months falls under here. Option C. Which of the following are used in management of hyperkalemia? 10% calcium carbonate IV is used. Regular insulin and glucose is also used. Nebulization by ipratropium, this is not used. Salbutamol is used. IV soda bicarb, yes, to stabilize cardiac membrane we use soda bicarb. Correct answer is, we'll remove 3, 1, 2 and 4. So nebulization by salbutamol is used in management of which electrolyte abnormality? Hyperkalemia. Option B. Question 123. Which of the following are correct regarding the weekly iron and folic acid supplementation program? Administration of supervised weekly iron and folic acid 100 mg and 500 microgram folic acid, this is correct. Administration of supervised weekly iron 60 is not given, 100 is given. 0.5 mg folic is same as 500 microgram. Biannual deworming, yes, annual deworming is not given, biannual is given. So correct answer is 1 and 3. Question number 104. Under the integrated management of neonate and childhood illness, caretakers are advised to return immediately to a health facility if any sick child is not able to drink or breastfeed. Yes, because this suggests sepsis. Fast breathing or difficult breathing in a child, yes, this is also correct. Blood in the stool in a child with diarrhea, yes, this suggests dysentery. Conjunctivitis in a child with measles, this is wrong statement. So 1, 2 and 3. Question 105. Correct statement regarding pediatric resuscitation in burns. Parkland formula estimates the amount of fluid to be replaced over 24 hours, correct. Volume of the fluid is equal to 4 ml into weight into total burn surface area, this is also correct. Additional maintenance fluid is also given. Half of the resuscitated volume should be given in the first 6 hours, this is wrong, it is given in first 8 hours and then the remaining half is given in the next 16 hours. So correct is 1, 2 and 3. Whole bowel irrigation as a method of gastrointestinal decontamination is useful for which of the following poisoning? Here it is used for iron poisoning. For kerosene and lavage, we know that we don't do any type organophosphor, we don't do any type of lavage. Question number 107. To prevent recurrence, expected mothers with a previous fetus with neural tube defect receive folic acid daily at a dose of 4 mg. For prevention it is 0.4 mg, but for deficiency we use 4 mg. Consider the following regarding non-invasive prenatal screening for screening high-risk pregnancies for aneuploidies. It is carried out on maternal blood. Yes. It is done before 10 weeks of gestation. No. It is done after 10 weeks, most commonly between 11 to 14 weeks. Negative predictive value 98, correct. Invasive testing is needed for confirmation of a positive test. This is also correct. So 1, 3 and 4. The risk of Down syndrome is 100%. What are the chances of the child having Down syndrome are 100%. Most commonly it is due to trisomy, but when it comes to translocation with 21 translocation of 21 chromosome with any other chromosome, if it is present in father, risk is 1 to 2%. If it is present in mother, the risk is 10 to 12%. But if there is a translocation between chromosome 21 and 21 and either of the parent is having the translocation, then the risk is 100%. So the correct answer is this, option number D. Question number 110. Which of the following are the example of genomic imprinting? Angelman and Prader-Willi. 1 and 3. Question number 111. Poisoning with which of the following drug causes hypothermia? So it is given in GHAI that hypothermia is associated with narcoleptic drugs like chlorpromazine. Number B. 112. Match the following urine color with the suspected poisoning in a child. Pink color with cephalosporin is usually not seen. Cephalosporin usually does not cause any urine color. Brown with chloroquine is present. This is correct. Greenish blue with phenazopyridine is wrong. Greenish blue is actually seen with amitriptyline. Red orange is seen with phenazopyridine. So only one pair is correct. This chart says urine color and the causative for reference. Question number 113. Consider the following agent and the cardiac effects in overdose of a poisoning. Prolonged PR interval with lithium, this is correct. Prolonged QT interval with amiodarone, this is also correct. Wide QRS with kerosene is wrong because kerosene usually causes arrhythmias. Tachycardia with OP poisoning. OP most commonly causes bradycardia, but tachycardia is also possible, so this is also correct. So 3 pairs are correct. Option C. Question number 114. If a baby does not begin breathing in response to tactile stimulation, then the baby is assumed to be in secondary apnea. So here is a quick review. That after the birth, if the baby is not breathing and we give tactile stimulation and it starts to breathe, this is known as primary apnea. But even after tactile stimulation the baby is not breathing, then it is known as secondary apnea. Question number 115. Consider the following statements regarding primary apnea. What is correct? Primary apnea, it responds to tactile stimulation, yes, and it leads to falling of the heart rate, but the blood pressure is normal, then the tone is also reduced. So B. Question number 116. Which of the following statements about the human breast milk is correct? 75% of the breast milk content is water, wrong. It is present 88%. Breast milk is poor in taurine, wrong. It is rich in taurine and cysteine. Breast milk is particularly rich in omega 2 and omega 6, this is correct. High lactose content of the breast milk help in absorption of calcium, this is also correct. So 3 and 4 are correct. Question number 117. Signs of good attachment during breastfeeding. Baby's nose is at the level of the nipple. This is wrong. It has to be above. Baby's mouth is wide open. Correct. Chin touches the breast. Correct. Lower lip is everted. This is also correct. So 2, 3 and 4. 118. A 6-year-old boy has recently started telling his full name. We know that tell the full name by 3 years of age. Although he cannot recite the poem. Reciting of poem is by 4 years of age. So the developmental age is 3. His developmental quotient is developmental age by chronological age into 100. Development is 3. Chronological age is 6 into 100. It is 50%. Question number 119. Consider the following statements. Hepatitis B has reduced efficacy if given IM. This is wrong. Ideally it is given IM only. It has good efficacy with IM. Maximum time allowed between reconstitution of MMR vaccine and use is 30 minutes. This is wrong. Maximum time is 4 hours. Maternal antibodies do not interfere with cellular immune response to BCG. This is correct. That is why we give BCG at birth, so that baby develops own immunity. DP whole is preferred over acellular pertussis for primary immunization. This is also correct because the whole component is cost effective when compared to acellular component. So 3 and 4 are correct. Rotavirus vaccination avoided during the episode of diarrhea because it might compromise uptake of the vaccine. This is correct because in acute GE transit time of the bowel is increased. That's why the drug does not stay in the bowel for absorption. It could trigger an episode of intussusception. This is correct, but it is not related to acute GE. It can cause intussusception even without acute GE. So this is wrong. Rotavirus is a live vaccine and hence may cause rotavirus diarrhea and worsen the. This statement is correct, but in acute diarrhea, for worsening of the diarrhea, the drug should first get absorbed, which is not possible. So this is also wrong. Here it is given in GHAI page number 194 that rotavirus vaccination when given in acute gastroenteritis, it will compromise the uptake.